Ellison Barber joins us from Mississippi, Jake Ward in California, and Dr. Scott Gottlieb, former FDA commissioner who's on the board of Pfizer. He's also the author of the upcoming book, Uncontrolled Spread. Ellison, you have been in Mississippi for days. It is getting hit very hard because of the very low vaccination rates. But I know you talked to some people who are now having a change of heart when it comes to this vaccine. What's making them change their minds?
You know, for some people, Stephanie, it is seeing the rising numbers here, seeing the 2 field hospitals that have been built in parking garages within 6 days of one opening, another one opening. It's seeing ambulances waiting in bays at their local hospitals because rooms are not open. And for a lot of people, it is being impacted directly by this. It's if they get sick or someone close to them gets sick that they're finally reconsidering. We met one woman, Lakita Brown. Her son, Keelan, was just released from the ICU at this hospital. He is 17 years old. She said that they had questions about the vaccines and they were torn on whether or not to get it. They were doing their research, trying to find answers. She said they had decided that she and the rest of her family would get vaccinated, but they decided too late. Her 17-year-old son tested positive for COVID-19. Listen to what she told us.
Would have done it sooner, a lot sooner. And I'm just thankful that the end result was not something heartbreaking, because it took me so long to make a decision.
Did you ever think when he was in the hospital or when he was at home that Keelan might not make it?
Yes, of course I did. He was having a lot of problems with breathing, and I cried a lot of nights while he was in ICU, and I prayed out to God to just keep him.
Lakita wanted to speak to us, and her son Keelan did too, even though he can barely speak above a whisper because he is still struggling to breathe, because they are hoping others will learn from their mistake. It is a decision, you heard her say, that she regrets not deciding to get vaccinated sooner. Now they have to wait for doctors to clear her son so they can get vaccinated. She says they will do that as soon as they get the go-ahead from medical professionals. But Keelan was the first to test positive in their family. It then spread throughout their whole household. Lakita tested positive. Her other son did. So did her 1-year-old grandson. The only person, Stephanie, in their entire household who did not test positive was an uncle, and he was also the only person fully vaccinated. Stephanie?
Wow. Sometimes it takes seeing people you know and love to actually get sick to realize how important this is. Jake, take us to San Francisco. You're in a city that's got very, very good vaccine numbers, and now the vaccine mandate is in effect for indoor activities. Overwhelmingly, are people happy about it?
You know, Stephanie, this is the city you would have laid odds might put this kind of policy in place. You'll recall that it was the very first city, it and its neighboring cities, to lock down back at the beginning of the pandemic. Well, now we're looking 18 months later at it being the very first city to require that indoor activities also come with the requirement of having a vaccination card. That means that your personal trainer, your bartender, the maitre d' at the restaurant has to, under this new city ordinance, check your vaccine status. That's unprecedented. So we went out and spoke to business owners across this city to find out, as dawn rises in San Francisco, what does this day and the days forward look like? We spoke to Ron Silverstein, who owns the Thirsty Bear. It's a sort of after-work bar that basically lost about a decimal place off of its revenue. It went from $100,000 in revenue a week to about $10,000 a week. We asked him whether he worried that this new vaccine requirement might hurt his business further. Have a listen.
If it gives people confidence to go out and to patronize their local bars and restaurants and gyms and this sort of thing, if it makes them feel safer, then it's a fantastic thing. It's not these decisions, I don't think, that's causing our fundamental problem of not having business. It's this horrible pandemic that's killing people.
It's not clear yet, Stephanie, how exactly enforcement will work here. But as of today, if you're going into a bar, you have to be checked. And as of October 13th, employees of that bar also have to be vaccinated. It's a grand experiment here in San Francisco. Stephanie?
Dr. Gottlieb, does enforcement of these mask mandates or the rules get a lot more complicated when you factor in the booster? Right today, Apple announced they're pushing back their return to work date to February. So let's say I go back to work next February and I've been vaccinated. I got both shots, but I haven't had the booster. Will that count as being vaccinated? How will we know?
I'd be very surprised to see businesses require a third dose to qualify for being fully vaccinated. I think the first 2 doses are going to qualify an individual for being construed as being fully vaccinated. You know, at some point, as we get further into this, as people get further out from their primary series, perhaps businesses will start to require boosters. But I don't envision that happening until certainly after this Delta epidemic surge, but even after the fall and the winter. Because after all, a lot of people who've been vaccinated have been vaccinated over the summer or have been recently vaccinated, and they're going to have a vaccine that's fresh that's going to carry them through certainly the Delta surge.
But if vaccine efficacy drops over time, do these mandates, will they have dates on when you need to be vaccinated by?
It's a good question. I don't think that they're going to tie these mandates, these requirements to a third booster. The businesses that are putting in place these mandates are asking people to be vaccinated by a certain date in terms of returning to work. People who are getting vaccinated right now are going to be in a good position because they're going to have a vaccine that's fresh, that's providing them good immunity through this Delta wave of infection. And one of the reasons why we might be seeing declining efficacy of the original primary series of vaccines that people received is that the doses were spaced close together. So one conversation people could have with their physician is about how to properly space the doses apart, whether there's a more optimal regimen for them, so people can make an individual decision about how they receive the vaccine.
Money motivates people. Axios is reporting that unvaccinated COVID patients who end up hospitalized are increasingly on the hook for big bills. Their insurance will not cover it. How much do you think that could have an impact on encouraging people to get vaccinated?
Yeah, I don't think it's really going to have an impact on the margins or on a wholesale basis. I think people who are choosing to go unvaccinated, many of them are people who don't think that COVID is going to affect them and certainly don't think they're going to require hospitalization as a result of COVID. So I don't think they're looking far enough down the field to see the implications, both the public health implications, the clinical implications, and the risk they're taking, but certainly the financial implications that if they do have a complicated course of COVID, that there could be costs associated with that. You're right that insurance companies now are no longer covering the out-of-pocket expenses associated with hospitalizations related to COVID. Initially, they were. Now they're starting to pull back.
If care gets rationed, right, we know that there are some states with no ICU beds left. Should vaccine status be a factor in who gets a bed?
Yeah, look, I don't think you could really do that in this setting because there's a lot of other settings where people choose not to get vaccinated, where they require hospitalization. We don't make those kinds of judgments. Certainly, flu is one of those. I mean, I practiced for years as an intensivist. I would admit a lot of patients with influenza. Many of them would be unvaccinated patients. We didn't differentiate in any way in terms of how we distributed care based on whether or not someone chose to get vaccinated with a vaccine that was safe and effective or not. So I don't think we're going to go down that path, but certainly we need to do all we can to continue to encourage people to get vaccinated.
Scott, stay with us because we've got to talk masks. We are getting a first look at how the mask orders are playing out in schools across the country. Some governors are trying to ban local districts from requiring students to wear them. I really don't understand why. The interim superintendent of Florida's Broward County Public Schools says only one student and one teacher in the entire district refused to wear masks on the first day of school, wouldn't follow the mandate. This is a district with more than 250,000 students. I want to bring in Vicki Hartwright. She's the interim superintendent of Broward County Public Schools. Vicki, that's extraordinary. Only one student and one teacher refused to wear a mask in a state where the governor is fighting against wearing masks. Were you expecting a lot more pushback?
We were anticipating some pushback on this. We've really been aggressive in trying to push out the message that it is required in order for our students to be able to come on campus and as well with our staff members. And so it was a little surprising. We did have people coming on campus without the mask, but we just simply asked, would you please put a mask on, and offered them a mask, and they put it right on and fell right in what we needed them to do in order to protect everybody.
We have heard the governor threaten that you're going to get money withheld from the state for implementing this mask mandate. Has that happened yet?
Not at this point in time. We are awaiting whatever sanctions that the commissioner is going to apply to the district. So we know that there's a letter forthcoming to us, but we have not received it just yet.
Scott, there are so many problems, lives being lost, learning lost. What is your reaction to the amount of time and resources being wasted arguing over masks for students?
Well, look, I think this is a deeply unfortunate debate we're having. I think governors should be leaving discretion to local officials to make decisions about how to employ the best mitigation in schools to keep children safe. Our goal, first and foremost, has to be to keep children safe and then try to keep schools open. And in Florida, you've seen a lot of districts close because they've had a lot of cases, a lot of outbreaks in those settings, and they've had to effectively close the schools. So they've lost part of their school year at this point. Different schools, different local districts have different resources available to them in terms of how to employ mitigation. They have different ventilation systems. They have different requirements on spacing or different opportunities to keep students spaced apart. So some districts are going to need masks because they're not going to have other alternatives. We should be leaving discretion to those local districts to make these decisions. It's unfortunate that governors have intervened to take that discretion away from the local officials.